There's a fresh wave of concern by doctors tonight over cases of walking pneumonia. Numbers released by Public Health Ontario show that cases are surging. Let's bring in Canada Tonight medical contributor Dr. Samir Gupta for more on this. Dr. Gupta, good to see you. Let's talk about this infection. What do people mean by walking pneumonia?
Yeah, it is a bit of an oxymoron. And when most people think of pneumonia, you're not walking around, you're sick. You're in bed or worse, you're in hospital. This is a very specific type of pneumonia caused by a bacteria called Mycoplasma pneumoniae. It tends to be milder. So this bacteria usually causes really an upper respiratory tract infection or a bronchitis, and that feels like a viral infection. In a small number of cases, it can actually cause a pneumonia, but that pneumonia tends to be mild. And that's why we call it walking pneumonia, because often people are walking around with it and don't realize they have a pneumonia. It's often seen in kids, so more often in kids, and that's what we're seeing in this particular outbreak with reports from Quebec, Ontario, BC, reports in the US, mostly in kids 5 to 17, but really can affect anyone, Travis.
Are folks with, respiratory issues, pre-existing respiratory issues like asthma, COPD, are they at risk as well?
For sure, and particularly with asthma, this particular infection is a known trigger for asthma attacks. People with this infection can have wheeze even if they don't have asthma. So anybody with an underlying condition is always more susceptible. So they're always sort of the exception to the rule. People who have a weak immune system or any underlying chronic condition, but particularly respiratory ones like the ones you mentioned.
Cases nearly tripled since 2019. Why do you think the cases are on the rise, especially amongst children?
Yeah, so kids are more commonly affected. That pattern is not that different than what we usually see. But you're right that we are seeing more cases. It's not something that's closely tracked, but we're seeing a higher positivity rate at the public health lab, and we're anecdotally hearing about a lot of positive tests. There is a cycle with this particular infection for reasons we don't fully understand. Every 3 to 7 years, it tends to sort of peak. So we were due for that, and it might be partly that. But it's also partly this unusual pattern of infections that we see coming out of the pandemic, where for several years, like other infections, we suspect that this one was quite uncommon. It was because of distancing and masking and washing hands, we prevented infections like this one, along with COVID and other viruses. But as we now come out and this particular bacterial infection finds its way into the population, it may have an easier time spreading because there's less of that immunity from recent infection, and people may be more symptomatic and coming to medical attention more. So we're becoming more aware of cases as a result of that.
And doctor, what kind of symptoms should people be looking out for, particularly parents?
Yeah, so it's interesting because it often will start as a upper respiratory tract infection, and even if you end up having the pneumonia, you'll often have those lingering symptoms, which are quite viral feeling and sounding. It's sore throat, runny nose, sometimes ear pain, headache, but also fever, body aches, fatigue, and ultimately cough. And the cough can be quite severe. It can be dry. It can be a productive cough. And I'm kind of listing off the symptoms of every virus that we've talked about in the last few years, including COVID. So it can be hard to diagnose, but if you have prolonged symptoms and a prolonged cough and fever and fatigue in particular,
right, is
when you should be seeing your doctor and thinking about this.
Okay, so as you mentioned, so this could present like it is COVID or something else. So there can be confusion at the beginning?
For sure, and confusion among people out there, but also among doctors. And we don't like to give antibiotics unnecessarily. We don't want to give antibiotics for viral illness, but this is one of those that can fool us because many of the features are suggestive more of a viral syndrome. And the fact that we're in a bit of an outbreak now, and the fact that people often present when they have prolonged symptoms, is what should be cluing us in to potentially do the swab, but also to treat people. And the antibiotics we typically use for community-acquired pneumonia will, in the vast majority of people, treat this infection as well.
How long does it usually last, and what happens if folks leave walking pneumonia untreated? Yeah,
so in terms of, and that's one of the reasons we call it walking pneumonia, it tends to be mild. So if you have an upper respiratory tract infection or even a bronchitis, you actually don't need treatment. Unless you have an underlying medical condition, most people will get over it without antibiotics. If you have the walking pneumonia, if it's actually causing a pneumonia, most people will need treatment because you will have prolonged symptoms. Once you get that treatment, though, Travis, you will get over this quite quickly, and you're not contagious for much longer than the period after which you finish your antibiotics in most cases. So, this is something that the body can fight off. But if you have a more significant infection like pneumonia, or if you have one of those underlying conditions, it becomes more important to treat.
And just real quick, ways to prevent transmission. Should you be masking up?
Yeah, it's the same. It spreads through droplets. So all the same things we've become very good at, washing hands, distancing, wearing masks. There's no vaccine for this, unfortunately. So it's just that prevention. If you're sick, don't go to work. If you're in a congregate setting like a subway car, wear a mask. All those things we should be doing now. Anyways, at this time of year will also protect you from this particular one, but it is very contagious.
Okay, good information as usual. Doctor, appreciate it. That is our medical contributor, Dr. Samir Gupta, joining us here tonight.